Welcome back, Titans. Today we are talking about positive pressure ventilation, specifically normal ventilation, how our patients breathing on their own, and how we are providing positive pressure ventilation, how we're doing it and how it's working inside the body and the things you should be aware of. Now, breathing for our patient, let's say they're breathing inadequately or they're in respiratory arrest, these items using CPAP or BVM or any of those mechanical features is a foundational skill that EMTs and paramedics should master. You should also know what's actually happening when you're changing how that patient is being ventilated. So let's get into the basics though. So what is ventilation? Ventilation is the mechanical process of moving air in and out of the lungs. This usually comes in two phases, which is inhalation and exhalation. So how does our patient ventilate themselves? So as our diaphragm contracts, our intercostal muscles expand the chest, generating a negative pressure in the chest cavity. This is a negative pressure sort of ventilation. This is how we breathe naturally throughout the day. Now, let's say our breathing is inadequate for our patient and we're using a bag valve mask. We've RSI'd our patient to intubate. We're using CPAP. We are going from a negative pressure system to a positive pressure system. And what does that do? Now, utilizing Nancy Caroline's Volume 1, 9th edition, we're going to talk about the different phases and what's happening in positive pressure ventilation versus our normal ventilation. So we talked about our normal ventilation being a negative pressure system, and we're going to a positive pressure system where positive pressure ventilation is the act of using a mechanical device to force air into the lungs. What happens to our blood movement? So in a normal series, normal breathing facilitates venous return, thereby maintaining our preload in our heart. But when we go to a positive pressure system, the interthoracic pressure is increased and it can impair venous return and the preload. And as a result, stroke volume and our cardiac output is decreased. So that's something important to remember. Say you have a hypotensive patient that you're going to be providing positive pressure ventilations to, it may affect their venous return. What about our airway wall pressure? In our normal ventilation, it's typically normal and not affected during normal breathing. But as you go to positive pressure ventilation, more volume is required to have the same effect as normal breathing. And as a result, the walls are pushed out of their normal anatomic shapes. Also something to be aware of. Esophageal opening pressure. We know that when we are breathing normally, our esophagus is not getting air in it. We're specifically drawing air in through our trachea. Now, when we're using positive pressure ventilation, forcing more volume and a higher pressure of air, you run the risk of gastric distension because air may be getting into the esophagus. We may have to use an OG tube or something to relieve that gastric distension. And then overventilation. This is non-typical in our normal ventilation. We're talking about specifically our patient is breathing at a normal rate, rhythm, quality, all that fun stuff. So if we overventilate our patient, though, with positive pressure, we can decrease the cardiac output of our patient. Forcing volume and rate results in increased interthoracic pressure, like we talked about, our distension, and can decrease our cardiac output. So keep in mind when you're providing these positive pressure ventilations for our patients and you're changing from a negative to a positive system, those are some of the things that are happening within their thoracic cavity. Gastric distension, our thoracic pressure increases, we can decrease venous return, and it's something to be careful of. So hope this helps. See you on the next one.